Scenario 3. In this training video, we will discuss and demonstrate how to properly care for an unconscious football player with a suspected C-spine injury. Upon initial evaluation, it is determined that the patient is not breathing, has a pulse, and is supine. In this scenario, the face mask cannot be removed as determined by the second rescuer after making an attempt to do so. There are 8 rescuers available. When first responders arrive on scene, one pre-designated rescuer, who will be referred to as Rescuer 1 from here on out, will assess the patient's level of consciousness and check pulse and breathing status. Rescuer 1 will then stabilize the patient's cervical spine using either the forearm trap squeeze or head hold method. Rescuer 1 will tell the rescuer with them to activate the emergency action plan using the predetermined signal of making an X with their arms over their head. Rescuer 1 has control of the situation and will give all commands as they are the person stabilizing C-spine. Commands will be given using specific rescuers' names so it is clear who is to complete which task. Upon seeing the emergency signal, additional rescuers on the sideline will activate the emergency action plan, call 911, send someone to meet the ambulance, and arrive on scene with emergency equipment. Rescuer 1 will communicate the patient's status with them. At this time, Rescuer 1 will also designate a rescuer to continuously monitor and record the patient's vitals throughout the entire rescue. Because the face mask cannot be removed, the whole helmet must come off to gain airway access. Rescuer 1 will direct another rescuer, who will be referred to as Rescuer 2, to take control of C-spine anteriorly and posteriorly using a vice grip underneath the patient's shoulder pads. Rescuer 2 now has control of the situation and will give all commands. Rescuer 2 will instruct Rescuer 1 to let go of their C-spine hold and remove the patient's helmet. Once the helmet is off, Rescuer 2 will then instruct Rescuer 1 to regain control of the C-spine and the situation. Now that there is adequate airway access, Rescuer 1 will instruct another rescuer to begin giving breaths using the jaw thrust maneuver rather than the head tilt chin lift so as to limit C-spine movement. If a bag valve mask is available, this is the ideal method of delivering breaths. This rescuer will continue to give breaths the entire rescue until the patient is breathing again or care is transferred. Pauses and respirations should occur only as necessary to complete other steps of the rescue and should be kept to as brief of periods of time as possible. At this point, if there is no change in the patient's status and EMS is on scene and ready to transport, rescuers would stop the spinal motion restriction process and allow the patient to be transported. If EMS would like to put the patient onto a spine board or stretcher, rescuers would help with that. Rescuer 1 will continue to hold C-spine during this process. If EMS is not on scene and or ready to transport yet, the spinal motion restriction process and breaths would continue. The next step is to remove the patient's shoulder pads and jersey. Using the T method, the rescuer will start at the top center of the jersey, cutting down and away from the patient's face, then across the sleeves from shoulder to shoulder. At this time, the rescuer will also cut the laces on the shoulder pads. Once the jersey has been removed, Rescuer 1 will instruct 2 rescuers to unstrap the sides of the shoulder pads. Rescuer 1 will then direct another rescuer, who will be referred to as Rescuer 2, to assume a vice grip and will transfer control of C-spine and the situation in the same manner in which it was done for the removal of the helmet. Rescuer 2 will direct one rescuer on each side of the patient's shoulders to slide their hands under the patient but over the pads and tilt the patient at a 45-degree angle. While the patient is being held in the tilt, Rescuer 2 will direct Rescuer 1 to remove the shoulder pads. Rescuer 2 will then direct those holding the patient up to lower the patient down to the ground. Rescuer 2 will transfer control of the C-spine and the situation back to Rescuer 1 once the patient has been lowered back down. The next step is to put the patient onto the spine board. Because there are 8 rescuers available, the best technique to do this is an 8-person lift. 6 rescuers will position themselves beside the patient, 3 on each side. 2 rescuers will be at the shoulders, 2 will be at the hips, and 2 will be at the legs. The last available rescuer will be in command of the spine board. At command of Rescuer 1, the 6 rescuers will slide their hands gently under the patient. Rescuer 1 will confirm that everyone is set, then will give the command for the rescuers to lift the patient 6 inches off the ground. Rescuer 1 will instruct the rescuer at the spine board to slide the spine board in and under the patient and will instruct them when to stop. Once the spine board is in place, Rescuer 1 will give the command to lower the patient onto it. Again, breaths are continuing to be administered and vitals are continuing to be monitored and recorded by the designated rescuers throughout the whole rescue process. Once the patient is on the spine board, rescuers will begin strapping the patient to the board at the torso, hips, thighs, and lower legs. Rescuers should use the X strap technique at the torso and hips. Rescuers should work together to put the straps in place and simultaneously tighten them. Rescuers will also strap or tape the patient's wrist and hands together at this time. Once the patient's body has been strapped down, The last thing to be stabilized to the board should be the patient's head. Rescuer 1 will instruct 2 rescuers to place blocks on both sides of the patient's head, one at a time, so Rescuer 1 can maintain cervical stabilization. Once the blocks are in place, forehead and chin straps will be placed around the blocks to further ensure the patient's head does not move. The patient is now ready to be transported to the hospital via ambulance.